Every day, millions of people around the world take bupropion as part of their treatment for mental health conditions. Doctors commonly prescribe it to help manage depression, improve mood, and support people who are trying to quit smoking. But what many people do not realize is that this medicine does far more than simply treat one condition. Once it enters the body, bupropion begins to influence several important systems, especially inside the brain. It can affect mood, mental energy, motivation, and even body weight. Some of these effects are very beneficial and help people regain balance in their daily lives. Others can be surprising, especially for those who are taking the medication for the first time. Understanding how this medicine works is important for anyone who uses it or wants to learn about modern antidepressant treatments. In this video, we will clearly explain 10 powerful effects of bupropion on the brain, mood, and body. Bupropion is a prescription medication mainly used to treat certain mental health conditions, especially depression. Unlike many traditional antidepressants, it works through a slightly different mechanism in the brain. It belongs to a group of medicines known as NDRI antidepressants. The term NDRI stands for norepinephrine, dopamine reuptake inhibitor. This means the medication increases the activity of two important brain chemicals called norepinephrine and dopamine. These chemicals play key roles in regulating mood, motivation, attention, and emotional balance. Because of this unique action, bupropion often produces different effects compared with many other antidepressant medicines. Doctors commonly prescribe it to treat major depressive disorder and also to help people stop smoking by reducing nicotine cravings. Over the years, it has become one of the widely used antidepressant medications in the United States and in many other countries around the world. Effect #1. Boosts dopamine activity. One of the most important things bupropion does inside the brain is increase the activity of a chemical called dopamine. Dopamine is often described as the brain's motivation molecule. It plays a major role in how we experience pleasure, reward, and drive. When dopamine levels are balanced, people usually feel more motivated, more interested in daily activities, and more mentally engaged. However, in many people who struggle with depression, dopamine activity can be lower than normal. This can lead to feelings of low motivation, lack of interest, and mental fatigue. Bupropion works by slowing the reabsorption of dopamine in the brain. As a result, more dopamine remains active between brain cells. Over time, this can help improve mental drive and emotional engagement. Many patients report that they start feeling more productive and mentally awake during the day. Tasks that once felt exhausting may slowly become easier to manage. While the effect is not immediate, gradual changes in dopamine signaling can help restore a healthier balance in brain activity and support improved motivation in everyday life. Effect #2. Improves mood and reduces depression. One of the main reasons doctors prescribe bupropion is to treat depression. Depression is more than just feeling sad. It often involves persistent low mood, loss of interest in activities, low energy, and difficulty concentrating. These symptoms can deeply affect daily life, work, and relationships. Bupropion helps address these problems by influencing important brain chemicals that regulate emotional balance. By increasing dopamine and norepinephrine activity, the medication helps improve communication between brain cells involved in mood regulation. Over time, this can gradually stabilize emotional responses. Many patients begin to notice that the heavy emotional feeling associated with depression slowly becomes lighter. They may feel less overwhelmed and more emotionally balanced. However, this improvement does not happen overnight. Like most antidepressant medicines, bupropion usually takes several weeks before its full benefits appear. During this time, the brain slowly adjusts to the changes in chemical signaling. With consistent use under medical supervision, many people experience a meaningful improvement in mood, allowing them to regain interest in life and daily activities. Effect #3. Increases energy levels. One surprising effect of bupropion is the way it can influence energy levels. Many traditional antidepressants are known to cause fatigue or drowsiness, especially during the early stages of treatment. However, bupropion often works in the opposite direction. Because it increases dopamine and norepinephrine activity, it can stimulate certain areas of the brain that control alertness and motivation. As a result, some patients report feeling more awake and mentally active during the day. This increase in energy can be especially helpful for people whose depression causes constant tiredness or lack of motivation. Instead of feeling sluggish, they may begin to feel more capable of completing daily tasks. Some people describe it as a gradual return of mental drive and productivity. However, the increase in energy does not mean the medicine acts like a stimulant drug. The change usually develops slowly as the brain adjusts to the medication. When used properly under medical supervision, this effect can help many individuals regain a sense of momentum in their daily routines and responsibilities. Effect #4 supports smoking cessation. Another important and interesting use of bupropion is helping people stop smoking. Nicotine addiction is strongly connected to dopamine pathways in the brain. When someone smokes, nicotine triggers the release of dopamine, creating a temporary feeling of pleasure and relaxation. Over time, the brain becomes dependent on this effect, making it very difficult for people to quit smoking. Bupropion helps by influencing the same brain systems involved in nicotine addiction. By increasing dopamine activity, it partially replaces the reward signal normally produced by nicotine. This can reduce the intensity of cravings that people experience when they try to quit smoking. In addition, the medication may reduce some of the uncomfortable withdrawal symptoms that appear during the quitting process, such as irritability, restlessness, and mood changes. Because of these effects, many doctors prescribe bupropion as part of smoking cessation programs. When combined with behavioral support and counseling, it can significantly improve a person's chances of successfully quitting smoking and maintaining long-term nicotine abstinence. Effect #5 may reduce body weight. Weight changes are a common concern for people who take antidepressant medications. Many traditional antidepressants are associated with weight gain, which can be frustrating for patients who are already dealing with mood disorders. Interestingly, bupropion often shows a different pattern. In some individuals, it may actually contribute to mild weight loss. This effect is believed to be related to how the medication influences appetite, metabolism, and brain chemicals involved in reward and hunger. Dopamine and norepinephrine both play roles in regulating appetite and energy balance. By increasing the activity of these chemicals, bupropion may reduce the urge to eat excessively, particularly emotional or stress-related eating. Some patients report a decrease in cravings for certain foods and a more balanced appetite throughout the day. However, weight changes can vary from person to person. Not everyone will experience weight loss, and the effect is usually modest. Still, compared with many other antidepressants, bupropion is often considered less likely to cause significant weight gain, which makes it an appealing option for some patients. Effect #6 improves concentration and focus. Concentration problems are very common in people who experience depression or certain mood disorders. Many individuals report difficulty focusing on tasks, remembering information, or staying mentally engaged in conversations or work. These cognitive symptoms can be just as frustrating as emotional symptoms. Bupropion may help improve focus and attention because of its effects on dopamine and norepinephrine. These two brain chemicals play a central role in attention control, mental alertness, and cognitive performance. By increasing their activity, the medication may help strengthen communication between brain regions responsible for concentration. As a result, some patients notice that their thinking becomes clearer and their ability to stay focused improves. Tasks that once felt mentally exhausting may become easier to manage. Because of these effects, Some doctors occasionally prescribe bupropion for individuals who struggle with attention-related difficulties. However, responses can vary among patients. While some experience noticeable improvements in concentration, others may experience more subtle changes. The overall goal is to help restore balanced brain function and improve daily cognitive performance. Effect #7. Lower risk of sexual side effects. Sexual side effects are one of the most common reasons people stop taking antidepressant medications. Many antidepressants, particularly those that strongly affect serotonin levels, can interfere with sexual desire, arousal, or performance. This can create frustration for patients and sometimes affect relationships. One notable advantage of bupropion is that it generally has a lower risk of causing these types of side effects. Because it mainly affects dopamine and norepinephrine rather than serotonin, its impact on sexual function is often different from many other antidepressants. In fact, some patients report little to no change in sexual desire while taking the medication. For certain individuals, doctors may even choose bupropion specifically because they want to avoid sexual side effects associated with other treatments. However, it is important to remember that every person responds differently to medication. While the risk is lower, side effects can still occur in some cases. Even so, this characteristic has made bupropion a valuable option for patients seeking effective depression treatment with fewer disruptions to sexual health. Effect #8. Can affect sleep patterns. Because bupropion increases activity in certain stimulating brain chemicals, it can sometimes influence sleep patterns. Dopamine and norepinephrine both play important roles in regulating alertness and the sleep-wake cycle. When these chemicals become more active, the brain may feel more awake and energized. For some people, this effect is helpful. They may feel more alert during the day and less mentally sluggish. However, for others, especially if the medication is taken later in the day, it may interfere with sleep. Some individuals report difficulty falling asleep or experiencing mild insomnia during the early stages of treatment. This is one reason doctors often recommend taking bupropion in the morning. Adjusting the timing of the dose can help minimize sleep disturbances. In many cases, sleep patterns stabilize as the body adjusts to the medication over time. While sleep changes are possible, they are usually manageable with proper medical guidance and careful dosing schedules designed to maintain a healthy balance between alertness and rest. Effect #9. Can increase anxiety in some people. Although bupropion is commonly used to improve mood, it can sometimes increase feelings of anxiety in certain individuals. This effect does not occur in everyone, but it is something doctors carefully monitor during treatment. Because the medication increases stimulating brain chemicals such as dopamine and norepinephrine, some people may initially feel slightly more restless or tense. This reaction is most likely to appear during the early weeks after starting the medication, when the brain is still adjusting to the changes in chemical signaling. For some patients, this temporary increase in alertness may feel like nervous energy or mild anxiety. However, these symptoms often improve as the body adapts to the treatment. Doctors may also adjust the dosage or timing of the medication if anxiety becomes uncomfortable. Regular communication with a healthcare provider is important during this period. With proper monitoring and guidance, most patients are able to continue treatment safely while allowing the brain enough time to adapt to the medication's effects. Effect #10. Rare but serious neurological risks. Like all medications that affect the brain, bupropion also carries certain risks that patients should understand. One of the most important concerns is its potential to increase the risk of seizures at very high doses. Although this complication is rare, it is the reason doctors are careful about prescribing the correct dosage. The risk of seizures becomes higher if the medication is taken in excessive amounts or combined with certain other medical conditions or drugs. For example, individuals with a history of seizure disorders may be more vulnerable to this side effect. This is why healthcare providers carefully review a patient's medical history before prescribing bupropion. Patients are also advised to follow their prescribed dosage exactly and avoid suddenly increasing the amount on their own. When used correctly and under medical supervision, the medication is generally considered safe for most people. However, understanding this rare but serious risk helps ensure that the medicine is used responsibly and that patients remain aware of the importance of proper dosing and medical guidance. Who should not use bupropion? Although bupropion is widely used and beneficial for many people, it is not suitable for everyone. Certain medical conditions can increase the risk of complications when using this medication. For example, individuals who have a history of seizure disorders are usually advised not to take bupropion because the drug may increase seizure risk. People with eating disorders such as anorexia nervosa or bulimia are also generally advised to avoid it, as these conditions may make seizures more likely when combined with the medication. In addition, bupropion may interact with certain other drugs that affect brain chemistry or metabolism. Because of these potential risks, doctors carefully review a patient's medical history, current medications, and overall health before prescribing the drug. Medical supervision is essential throughout treatment. Patients should never start, stop, or change the dose of bupropion without consulting a healthcare professional. Careful evaluation and proper monitoring help ensure that the medication is used safely and effectively for those who can benefit from it. Bupropion is considered one of the more unique antidepressant medications used today. Unlike many other treatments for depression, it works through a different pathway in the brain, influencing important chemicals such as dopamine and norepinephrine. Because of this mechanism, its effects can extend beyond mood improvement. It can influence motivation, mental energy, focus, and even body weight in some individuals. For many patients, these combined effects can lead to meaningful improvements in daily functioning and overall quality of life. However, like any medication that affects brain chemistry, it must be used carefully and responsibly. Bupropion should always be taken under proper medical supervision with the correct dosage and regular monitoring by a healthcare professional. Understanding how medications work inside the body allows patients to make safer and more informed decisions about their treatment. The more people learn about medicines like bupropion, the better they can use them effectively while protecting their long-term health.